Viral diseases are the most common and important diseases in fish. The general characteristics of viral infections of fish are temperature-dependent, pathogenicity, and host-specific. Usually, the younger fish get sick than the older ones, which become carriers of the virus. Ulcer. This is a mild to severe disease. Primarily, mononuclear infiltrate is present. Extensive collagen deposition of lipids contributes to tissue swelling and disproves the nature of disease. Epizootic ulcerative syndrome, or EUS. This is a complex disease related to rhabdovirus, the bacterium Aeromonas hydrophila, and fungus Aphanomyces invadans. The symptoms are severe ulcerative and dermal necrosis with extensive erosion. Necrotic muscular tissue emits foul odor. This is also cause for hemorrhagic and scale loss. The disease is detected through isolation or identification of the virus. Viral nervous necrosis, or VNN. Affected larvae of viral nervous necrosis show lethargy, pale color, loss of appetite, thinness, loss of equilibrium, and corkscrew swimming. Some sink to the bottom and float to the surface again. Affected fish had pale livers, empty digestive tracts, intestines are filled with greenish to brownish fluid, and spleen are red spotted. Virus replicates in the eye, brain, and distal spinal cord. It multiplies in the gonad, liver, kidney, stomach, and intestines. Histopathology showing vacuolations in the nerve cell of the eye retina and the brain of affected fish is diagnostic for the disease. The virus can be isolated in SNN1 and barramundi cell lines on which it induces CPE. The virus can be identified with fluorescent antibody technique. Lymphocytes disease. Infected fish had clusters of pear-like nodules up to 5 millimeters in a diameter that develop on the skin, gills, or fins, resulting from enlarging of tissue size. The disease is seldom fatal in older fish. It can be transmitted by cohabitation and exposure to contaminated water. Lymphocytes disease is detected through the signs of disease itself, histopathology, and EM. Grouper iridovirus of Taiwanese disease, or TGIV. Deceased fish swim in the circles and are anemic. Fish lose appetite and then become underweight and lethargic. The spleen of affected fish has abnormal hypertrophied cells containing numerous icosahedral virions. The virus has antigenic similarities with the red fibrin iridovirus, isolated in Japan. The epizootic, hematopoietic necrosis virus, and iridovirus isolated from the sharefish, and the grouper iridovirus isolated in Thailand. This disease affects farmed groupers. Acute disease causes up to 60% mortality. Experimentally infected disease. This disease affects farmed groupers. Acute disease causes up to 60% mortality. Experimentally infected fish reach a cumulative mortality of 100% in 11 days without other clinical signs. Grouper iridovirus of type 1 disease is detected through the signs of the disease and EM. Sleepy grouper disease. Sleepy grouper disease results to extremely lethargy and low appetite in the affected fish. It swims alone or hung at the water surface or remains at the bottom of the sea or pond. Affected fish has poor resistance to stress. Mortality is above 90%. The disease is detected through histological demonstration of the eosinophilic intranuclear inclusion bodies, the hepatopancreas by H&E staining, electron microscopy, DNA probe, and infection bioassays. So how to prevent the viral diseases? There is no treatment in the viral infection in fish. Hence, preventive measures must be adopted to keep the viral pathogens away. Avoidance is the basic consideration in preventing the occurrence of the viral disease, and the use of viral-free fry for stocking in ponds is highly recommended. It should also be borne in the mind that semi-intensive and intensive culture systems promote conditions conducive for disease development. As such, reduction of stress and the application of a good husbandry are efficient technology that may prevent occurrence of the disease.